Bismillah ar-Rahman ar-Rahim. Today we will have case quiz number 58. Case data: 43 years old female presented to the vascular clinic with acute onset cramping pain and numbness in the left hand. This morning she had noticed a black patch on the tip of the thumb and index finger. She is heavy smoker and is on medication for hypertension. On examination, the hand is warm and well perfused with a palpable radial pulse. Allen's test is normal and there is no upper limb neurological deficit. A hard bony swelling is palpable in the supraclavicular fossa. It is not pulsatile and is immobile, so not mobile and not pulsatile. The investigations done are plain radiograph of the thoracic inlet is done and shows this is the X-ray done for the patient. Look for the X-ray and answer the case. So, what is the diagnosis? Looking for this X-ray, especially this part. Can you see the arrow here? Yes. So the answer is yes, of course. The answer is cervical rib. Cervical rib. Cervical ribs have an incidence of around 0.4% in the general population, which means that among every 250 persons of the population, we can see one case of cervical rib, either unilateral or bilateral. The subclavian artery runs over the rib and can be compressed against it. An aneurysm of the artery developing at the point of compression is a rare complication. Thrombus within the aneurysm sac can immobilize the digital arteries and can cause fingertip gangrene or even digital infarction. Thrombosis and occlusion of the subclavian artery can also occur. The brachial plexus runs with the cervical rib, and compression of T1 nerve root can cause numbness, paresthesia, and weakness. Symptoms may be relieved by surgical excision of the rib. So, the manifestation of cervical rib may be a combination of vascular and neurological symptoms at the same time. The thoracic outlet syndrome can be mimicked by prominent cervical discs, spinal cord tumors, cervical spondylosis, Bancost tumors, osteoarthritis of the shoulder, carpal tunnel syndrome or ulnar neuritis, and many other differential diagnoses. An electrocardiogram is required to exclude immobilization secondary to cardiac arrhythmia such as atrial fibrillation. A color Doppler ultrasound scan or an angiogram would determine the presence of a subclinial aneurysm and allow the assessment of distal circulation. The key points here are: cervical ribs have an incidence of around 0.4% in the general population, and symptoms may be relieved by surgical excision of the cervical rib if not treated with good medications. And finally, thank you very much for your attendance, and we will meet you tomorrow with case quiz number 59. Wassalamu alaikum wa rahmatullahi wa barakatuh.